special one.
The Al Ansar Foundation, Da'wah, Tarbiyah, and Education, establishing the foundations of Islamic civilization in South Africa.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين والعاقبة للمتقين والصلاة والسلام على رسوله الكريم سيدنا محمد وآله وأصحابه أجمعين برحمتك يا أرحم الراحمين. All praise due to Allah, the Lord, cherisher, nourisher, sustainer, and master of the universe, the most gracious, the most beneficent, the most merciful. Ya Allah, it is on you that we worship and is your guidance that we seek. Ya Allah, keep us in a straight path. Ya Allah, shower us with the choice of blessings. Ya Allah, shower us with your mercy. Ya Allah, guide us. Greetings, salams, salutations on our beloved Nabi Muhammadur Rasulullah sallallahu alaihi wasallam. It's time for Medical Files, brought to you by the Islamic Medical Association of South Africa and hosted by myself, Faizal MJ Suleman. Assalamu alaikum wa rahmatullahi wa barakatuh. We welcome our listeners on Radio Al Ansar, CII Radio, Voice of the Cape, Radio 786 Sirius FM, Radio Islam and IFM Port Elizabeth, and all listening to us on audio streaming and other platforms. Our topic for discussion is prevention of kidney disease. And to discuss this condition, we welcome Dr. Ismail Ghulam Hussain Randri, a specialist physician and nephrologist practicing in Durban. Dr. Randri, assalamu alaikum wa rahmatullahi wa barakatuh, and jazakallah khair for joining me on the program this morning.
Wa alaikum assalam wa rahmatullahi wa barakatuh, and a sincere salams and peace greeting to all listening.
Dr. Randri, I did mention that our topic for discussion is prevention of kidney disease. What is kidney disease?
Bismillahir Rahmanir Rahim. So, in a layman's term, anything that damages the kidney and therefore prevents filtration of waste products, we will call kidney disease. Now, important to know that our merciful Lord provided us with a kidney that not only filters, but it is responsible for production of vitamin D, its production of a protein called erythropoietin, and it also helps in excreting uric acid and phosphate. And as this program unfolds, we'll see the relevance of what the kidney does.
Mm-hmm. Now, having said that, how does kidney disease present itself?
There are several ways, and the listener must understand that whatever I mention is not necessarily only due to kidney disease. So the first is often patients complain of a low backache. So if we feel at the back between the spine, so on either side of the spine, lower end of the rib cage, if you got pain there, that's where the two kidneys are usually located. So a low backache is one, what we call sign or symptom. Body swelling, sometimes around the eyeball, we call it periorbital edema, sometimes over the lower limb, the legs, body swelling is a second. Third, often these patients feel very tired, they are fatigued, and that's because their hemoglobin is low. Fourth, patients might notice that the urine is no longer the clear amber yellow color. It's dark. Some describe it as coffee-like or Coke-like. Others say that, look, my urine, I've noticed, is foamy. And fifth, they sometimes, not always, have trouble in sleeping, but insomnia is not uncommon in other people as well. And others may have shortness of breath if they are retaining fluid. So to summarize, low backache, body swelling, tiredness, change in the urine in terms of darkness and foamy, and trouble sleeping. That's what I think most people will present with.
Mm-hmm. Now, this is an interactive program, and you can send us your questions that you might have on kidney diseases via WhatsApp on 060 904 1056. I repeat, 060 904 1056. Now, Dr. Randri, a question that comes through is, I am a 24-year-old male. I notice blood in my urine and have backache. Should I be worried? I think you did mention that it presents itself with possible backache and discoloration in urine.
Excellent question. Any male who has blood in the urine, from the beginning, that individual needs to have an investigation. In the case of females, if they notice dark urine, it may very well be around the time of the menstruation. So the message is dark urine, backache, try and establish whether or not you've got kidney disease. It can be in the form of stones. Some people pass blood in the urine. We call it terminal hematuria if they've had bilharzia. and we want to make sure that this individual doesn't have what we call renal tumor. The best person to see in this case is your general practitioner. Let him or her send the urine off, do a blood test, and ideally do a scan called ultrasound of the abdomen. So this is a very important question. No male listening to this program should have blood in the urine with backache and not investigate it.
Now, also, Dr. Randy, there's two terms that we hear very often. That is acute and chronic. Now, what do these terms mean? And what does it mean when the doctor says you've got acute or chronic kidney problems?
In essence, acute means that whatever illness that you are presenting with is less than 3 months. Chronic means whatever you are presenting with is more than 3 months. So let's take this patient who said he noticed dark urine, he's got a backache. Let's assume he had these symptoms in December. He ignored it. Now, during the month of Ramadan, he notices he's got backache again on either side of the spine. His urine has become discolored. He goes to his general practitioner. They check the urine with a dipstick. There's blood in the urine. There may be protein in the urine. There may be cast in the urine. This individual now has got a history. That means he noticed it in December. He's now in April got it again. It's more than 3 months. That is called chronic. Acute means you have an illness, often acute kidney failure or acute kidney injury occurs due to accidents, motor vehicle accidents, blood loss at the time of acute illnesses, septicemia. So that's the difference.
Mm-hmm. And, you did mention how it's going to present itself, and, you spoke of different conditions, but how will I know if I have kidney disease?
Again, often patients will say, I know I got high blood pressure, or I know I got diabetes. High blood pressure means you got to check your blood pressure. Mm-hmm. Diabetes means you got to check your sugar. So the gold standard in terms of how do I know I got kidney disease is you have to do 2 things. You have to do a blood test. The blood test is called a urea and electrolyte or a kidney function test. They look especially at the level of a protein called urea, another protein called creatinine. If both of them are elevated or raised, the laboratory then calculates what we call a EGFR, an estimation of the glomerular filtration rate. To the listener, glomerulus is the functional unit of our kidney that allows the filtration. So if the EGFR is under 60, and I'm going to go through the stages quickly, if the EGFR is under 60, then that means that there is some element of kidney damage. However, you are also obliged, or the doctor is obliged to check the urine with the dipstick to see if there's blood or protein. Often they have protein in the urea. So you take the 2 together and you then diagnose kidney disease in that patient. So a low EGFR under 60. Now, EGFR has 5 stages. Principally, EGFR under 15 means end stage, 16, right, to 30 means stage 4, 31 to 49 means stage 3, and then 45, I beg your pardon, 45 to 60 means 3A. The listener doesn't have to trouble himself or herself with the staging right now, but do a blood test and do a urine and establish with your doctor.
Mm-hmm. Now, is kidney disease hereditary?
There are many hereditary conditions. The list is long. The 2 important ones I want to mention, because in our community in Durban and certainly in South Africa, there are patients who have what we call polycystic kidney disease. This is a hereditary condition. So if any listener has a family member with polycystic kidney disease, we call it autosomal dominant polycystic kidney disease. It's a diagnosis made on ultrasound. They must necessarily screen the family members. The other one is what we call hereditary cystinosis. There are families in our community where they have stone formation, and there is an abnormality in cystine formation. The others are rare, but these are the 2 important hereditary conditions.
060-904-1056, 060-904-1056. If you have any questions on prevention of kidney diseases or of kidney diseases, then you may forward them to us. Our guest in the studio this morning is Dr. Ismail Ghulam Hussain Randri, and he is a nephrologist dealing with kidney situations. Now, Dr. Randri, there are many medical conditions wherein kidney disease may occur, and there's a question that comes through. It says, I am a 55-year-old male with diabetes for 20 years, hypertension for 20 years, cholesterol for 10 years. I've had an angiogram. I've had stent, put in 2 years ago. During my last visit to the doctor, I was told I have kidney damage. Please advise, how can one prevent getting kidney problems in my conditions for other patients to learn from? But more important also, doctor, is that, maybe while dealing with this, you can also, advise us whether there are any other medical conditions wherein kidney disease may occur as well.
Bismillah ar-Rahman ar-Rahim. So, Faizal, what an interesting question. So, here we have what is typically seen in our dialysis units.
Mm-hmm.
So, if you happen to go to a hemodialysis unit and you look at the patients who are on dialysis, a great majority will have either diabetes or high blood pressure,
Mm-hmm.
or both and or heart disease. So let's take each one separately. Any patient or any individual listening to this program who's got diabetes, remember there are 5 complications of diabetes we must always think about 10 to 15 years from the time of diagnosis. Eye changes, we call that retinopathy. Heart changes, we call that cardiac disease. Kidney, which is what we're dealing with. Circulation, peripheral vascular disease. Regrettably, some diabetics need amputations, and then there's the neuropathy. Neuropathy can either be peripheral, that means they got pins and needles, numbness, tingling, or autonomic, they have dizziness and erectile dysfunction. So no diabetic listening to this program must think that if I got diabetes for more than 10 to 15 years, kidney is the only one involved. Now, when you go as a diabetic patient to the eye specialist, and the eye specialist says you've got damage due to diabetes, invariably, you will have kidney damage. So it becomes incumbent on the doctor looking after you to check the urine and the blood. High blood pressure, most of us don't even know we have high blood pressure. We've done programs in the past as it being a silent killer. So the high blood pressure now will result in damage to the kidney, protein loss, and kidney damage itself. And then we worry about the brain and stroke. So high blood pressure, diabetes, both that this patient got, would over time cause kidney damage. Now, when it comes to an angiogram, remember the doctor who does the angiogram is going to use contrast,
Mm-hmm.
radioactive contrast. The contrast, which allows him to see the vessels, the contrast can be 30 mils, others use up to 100 mils. This contrast can damage an already existing kidney disease patient. The other condition that you are asking me about, very important. For example, patients who got arthritis. Now, arthritis we categorize as osteoarthritis, rheumatoid arthritis, lupus, which is connective tissue disease arthritis, uric acid gouty arthritis, and there's a condition called psoriasis, skin condition, psoriatic arthritis. By and large, all arthritis or inflammation of the joints, the doctor, whether it's a rheumatologist or orthopedic surgeon, will innocently, and I'm saying this deliberately, will innocently advise you to take painkillers. The category of painkillers that we are talking about are called non-steroidal anti-inflammatories. I will mention names, not necessarily one, so that no drug company feels that we are targeting them, but you will find so many of our patients taking Brufen, Voltaren, Indocet, Coxflam, Arcoxia, Celebrex, Vimovo, you name these anti-inflammatories. And most of them, when you take them, they will decrease circulation into the kidney because they are antiprostaglandin and will damage the kidney circulation and damage the kidney. So you got a category of patients where there's diabetes, high blood pressure, heart disease, osteoarthritis. Many of them are over-the-counter drugs. Mibulin is one of them.
Mm-hmm.
So one needs to be cognizant. One needs to be aware that whatever condition I got, at least once a year, let me check the kidney function to make sure that I'm not deteriorating, rather than concentrating only on diabetes or high blood pressure or heart disease.
Mm-hmm. A question comes and says, Salams, if my urine is very clear like water, what does it mean? And I'm diabetic, I'm not in control, I'm always 16 or 14.
Okay, clear urine often is a manifestation of hydration. So, if you have adequately hydrated yourself, you're taking enough fluid, you're diluting the urine, so clear urine is a good sign. There are individuals where clear urine is due to the fact that the kidney is unable to concentrate it. So, when you have certain types of kidney diseases, the ability to concentrate your urine and make it dark is no longer there. So, the specific gravity of the urine, instead of being 1020, is 1010. So, in a nutshell, clear urine seems to be reasonable in terms of a diabetic. Poor control of diabetes. If you're saying to me your sugar is 14 and 16, you have to do the blood test called HbA1c, which is a glycosylated hemoglobin. That is a standard test. It tells you what your average sugar is for the 3 months prior to the test. If the HbA1c in a treated diabetic is more than 7, then your doctor will have to necessarily adjust the medication to bring it down.
Just a reminder that doctors and guests on the Medical Files program will help you with any medical problems you pose by giving you advice on air. However, they do not have your full medical history and have not examined you. Please verify the advice given to you on air with your regular doctor who knows your medical history, allergies, etc. Neither the doctors nor the relevant radio station nor the Islamic Medical Association of South Africa will take any responsibility for any adverse reaction caused by the advice given on Medical Files. Just a reminder that this is an interactive program. We are discussing the prevention of kidney disease, and then you may forward to us your questions via WhatsApp on 060-904-1056. Now, Dr. Randy, a question has come through. It just digresses slightly, but it talks of kidney stones. Can I pose that question to you, Dr. Randy?
Bismillah ar-Rahman ar-Rahim. Kidney stone.
I've got a specific question. Can I pose it to you?
Yes, you can.
It says, my husband has kidney stones, and 2 weeks ago he was in severe pain. He visited a urologist who gave him Uromax and painkiller, did an x-ray which showed one stone on the left and one on the right kidney. One stone came out and the other is still inside him. Visited another urologist who said he must not drink too much water. He must not drink too much water, and the second stone will come out. He is in constant pain, not very severe, and is back at work. Have an appointment with King George for the CT scan, seeing that the pain is still constant. One urologist said, drink lots of water, and the other said, no. What do we do seeing the stone is still within him? This is the 7th time he has kidney stones, but the symptoms are different this time.
Bismillah ar-Rahman ar-Rahim. So that's a very interesting question. So now what we've got a recurrent stone former.
Mm-hmm.
Number 2, if he's had stones before, I'm not sure if they managed to take the stone out, because often if a person's got a stone history, we give them what we call a Euro cup, a cup to pass urine in. So in the event that a stone comes out, the most important test on this patient is a stone analysis. Meaning that stone that comes out, if you can retrieve it, if you can save it, send it to the laboratory. The laboratory will automatically tell us whether the stone has got calcium in it, uric acid in it, whether it's what we call a cystine stone, or where you have recurrent stones, it may be due to intercurrent infections through white stones. So those are the 4 categories of stones. Now, dear listener, for us to advise you means that we need to know, number 1, why your husband is forming recurrent stones. 2, whether there is an analysis of the stone that can help us, because if it's a calcium stone, then we advise you on the diet. If it's a uric acid stone. Now, in terms of the question of fluid intake, let's go to the whole situation. If you've got stones in the kidney, they start to pain when they leave the kidney. There's a part of the kidney called the pelvis of the kidney, which is just above the pipe called the ureter. So it's when this kidney starts to move from the pelvis into the ureter that you start getting spasm. And so drinking lots of water. Now, what is lots of water? Well, it depends. Often we see stone formation during Ramadan. When patients are fasting, they are relatively dehydrated. So it's a term that's difficult to tell you over the airwaves, But 1.5 to 2 liters of flushing the kidney. Firstly, you got to stop fasting. 2, you got to do frequent water intake, right, to flush the kidney and use the urocap. Now, if the other stone is high up in the kidney parenchyma, we call it, in the actual tissue of the kidney or pelvis, the chances are you can't do much because you don't want to blast it. I'm assuming that the urologist didn't want to blast it. What they sometimes do is they wait by increasing fluid intake. Again, increasing fluid intake is a nebulous term. How much is lots of water? 1.5, 2, 2.5, it all depends on hydration. The hope is that by taking excess water, avoiding fasting, you're going to encourage the flow of the urine to push that stone down. If it comes into the ureter closer to the bladder, then they may put what they call a dome or basket. They may go in and remove it and leave a stent in. So the answer to your question in terms of fluid is dependent on whether he's fasting, whether he takes normally lots of fluid. But the biggest answer is find out what the stone is to correctly treat it.
Jazakallah khair for that. You are listening to Medical Files brought to you by the Islamic Medical Association of South Africa. We are discussing prevention of kidney disease and our guest is Dr. Ismail Ghulam Hussain Randri. Any questions are most welcome on 060-904-1056. We want to visit the marketplace, and on the other side of this, we would be discussing how does one approach a patient with kidney disease. But right now, we'll take this ad break.
Station for Conversation, Radio Al Ansar.
Save the date for Saturday, April 27, 2024. Why, you may ask? Well, it's the Hajj seminar from 7:45 a.m. to 1:30 p.m. at 207 West Road in Overport. Proudly brought to you by the Al Ansar Foundation and the Capital Group of Companies.
When the month of Ramadan arrives, the doors of mercy are opened. Sahih Muslim. From our home to yours, Simplex Radio wishes you, the Ummah of Muhammad sallallahu alaihi wasallam, a blessed Ramadan. May peace fill your hearts and homes. May your du'as and fasting be accepted. And may Allah shower His blessings on you and your loved ones. Ameen. Simplex Radio, the name you can trust.
This Ramadan, experience the joy of receiving rewards by quenching the thirst of a fasting person at the time of iftar. Join the dynamic Faizal MJ Suleman
And the charismatic Suraj Basa as we commit to providing refreshing water and dates for iftar to masajids and musallas around Durban.
Your donations matter. Visit www.alansar.org.za or call the Al Ansar Foundation on 031 208 1601.
Lillah only. Make a meaningful impact this Ramadan. Together, let's share the reward of the sacred month.
It's that time again where the Afternoon Jam team is on a mission to bring relief to many homes. Join me, Fahim Jamida, and Kelly Ramzani as we spearhead the Hamper of Hope initiative. Our target this Ramadan is to provide 3,000 grocery hampers to the less fortunate families. Let's come together and make a difference. For just 300 Rand, you can be part of this incredible journey, contributing through Zakah and Lillah. Let's shed hope and brighten Ramadan for those who need it most. Join the Afternoon Jam commitment, because together we can make this Ramadan unforgettable. Donate now on www.alansar.org.za or call Outreach on 031 208 1601.
The Al Ansar Foundation, Da'wah, Tarbiyah and Education, establishing the foundations of Islamic civilization in South Africa.
You're listening to Medical Files brought to you by the Islamic Medical Association of South Africa and hosted by myself, Faizal MJ Suleman. We are discussing prevention of kidney disease, and our special guest in the studio is Dr. Ismail Ghulam Hussain Randri, a specialist physician and nephrologist. And you can forward to us your questions on prevention of kidney diseases on 060-904-1056. Now, Doc, a question just came during the ad break. It says, Assalamu alaikum, Jazakallah khair for a lovely, informative program. I am a 54-year-old female having chronic flank, back and severe hip pain, fatigue. I did blood tests and my GFR is 60. Do I need to see a nephrologist? Please advise. Jazakallah khair.
Bismillah ar-Rahman ar-Rahim. What a lovely question. So at 54, chronic means more than 3 months. Flank means that area where not only the kidney is going to be sitting. If it's on the right side flank, you got a liver sitting there. If it's on the left, you got the spleen. Over and above that, in a female patient, Faisal, we have to take into consideration the gynecological. So when you do, as a medical student, renal medicine, they do what they call genitourinary. You have to take into account, dear listener, that you need to rule out on an ultrasound scan whether this is truly kidney related, in which case you're looking for stones, masses, you're looking for obstruction, or whether or not there is a problem within the pelvis where you got a fibroid uterus or you got ovarian masses, etc. So try not to go to a nephrologist immediately. Your family practitioner should fill a form for you, ultrasound of the abdomen plus the pelvis. My patient got chronic flank pain, got back pain, got hip pain. Now, when you got back and hip pain, then we must also understand at 54, have you got osteoporosis or osteopenia? Is there any problem with the lumbar spine in terms of spondylosis? So I would recommend the following in a nutshell. Do an ultrasound of the abdomen and the pelvis. So that way you look at the anatomy, and do an X-ray of the lumbar spine as well as both hips. And I think that's where I would start before I go and see any specialist.
Jazakallah khair for that, Dr. Henry. Another question comes in. Salams, what does it mean if there is an odor in your urine? I am a diabetic. I take 2 insulins, and in 2013 I got a kidney problem. I'm just reading as she sent it to me. Shukran.
Bismillah ar-Rahman ar-Rahim. So an odor in the urine is one of 2 types. When you have excess sugar coming out from the urine, it's got a particular odor that is more in a diabetic population because of the sugar that's in it. But you can have an odor in the urine if you got infection. And often diabetics don't realize that they got bladder infection. Symptoms of bladder infection: pain in the urine, frequency of urine, urgency of urine, burning of urine, and changes in the color of the urine. Therefore, I would say to you, it could either be ketones, which is the excess sugar in your urine giving you the odor, or you have to do what we call a midstream urine for culture, MCCS. So that's my recommendation. Either you go to your family practitioner, he checks your urine, he sees whether there's blood, protein, nitrites, leukocyte esterase. He'll advise you whether he thinks there's infection. I'm not too much in favor, Faizal, of just doing a dipstick in a diabetic with this sort of situation. I rather spend a little bit more money, send a proper urine sample called midstream urine to one of the reputable labs, and make sure that I don't have a situation of infection, because the infection in the urine could either be bacterial or what we call candidal. And so you don't just do a dipstick and put them on antibiotic. You identify whether there's infection or not. Thank you.
Jazakallah khair, Doctor. In fact, another question has come through. It just says, high sugar. Will high sugar give kidney disease? I'm 80 years old.
Bismillah ar-Rahman ar-Rahim. At age 80, Alhamdulillah, you've reached 4 scores. May Allah subhanahu wa ta'ala make it such that only your good deeds are recorded.
Ameen.
I would feel that at this age, the idea is to make sure you check your kidney function. If you are a diabetic, or you had high blood pressure, or you had kidney disease in the past, see where the level is. Now, at age 80, you and I are not going to expect. By the way, 80 is 30,000 days on earth. That's how much our merciful Lord has kept you, dear listener, on earth, 30,000 days. So at this age, the EGFR can be anything between 40 and 60. So we have to adjust the EGFR value at age 80. We can't expect it to be 60. So the question, if you can just remind me, Faizal, was?
She sent us a question previously. So, Salams, if urine is clear, very
no, this
clear.
Is the man with the age.
No.
80.
It's a continuation of that question.
Right.
Okay? The same person sent it. Will high sugar give rise to kidney diseases? I'm 80 years old.
Yeah, well, high sugar does give rise to kidney disease. That was initially what we discussed. But at age 80, just do a GFR, do a urine for analysis, and work from there.
I'm going to pose two questions to you, Doc, if you don't
Yeah.
mind.
I see. I'm happy, Faizal. There are so many questions coming through,
Alhamdulillah.
and I think that's the basis of what we are trying to do. Educate ourselves first and the listeners.
Absolutely. Assalamu alaikum, Ramadan Mubarak. I am a 58-year-old female. Few years now, I have blood in my urine. I had a treatment with antibiotics, didn't help. What's the next step? Currently awaiting urine result. Yep. And then, similar question say, I'm a 70-year-old male. Recently, I have a problem in passing urine. Urgency, frequency, hesitancy, and pain. Should I be worried? I'm just marrying both the questions, if you don't
Right.
mind.
Okay. Bismillah ar-Rahman. So the first patient, firstly female,
58 years.
age 58. We don't know whether there's diabetes, high blood pressure, urine, gout, rheumatoid arthritis medication. But if you've got blood in the urine at age 58, and if you are post-menopausal, right, then we need to establish whether the blood is coming from the bladder or the kidney. We sometimes do a urine sample looking for what we call dysmorphic red blood cells. That's what your general practitioner will ask for. They will rule out infection. But I think the most important message is for you to set an appointment with the urologist. There are female urologists in and around Durban if the patient is from Durban. If you are shy, to go to a male urologist, because this recurrent blood in the urine needs urological investigation. Is it coming from the pipe between the bladder and the outside called the urethra? Sometimes they have a stricture. The bladder itself may be chronically inflamed, so they have to do a cystoscopy. An ultrasound needs to be done to make sure you're not sitting with stones or tumors. So my recommendation to the 58-year-old lady is have it investigated, and I told you how. Regarding the 70-year-old, that's such a lovely question, because as we age, we're going to have an enlargement of a gland called the prostate. The prostate lies just above the urethra. That's where the passage of urine comes out. It is sometimes enlarged. The bladder becomes distended. Patients void urine, but they don't empty the bladder completely. This gentleman will need a PSA, a blood test called prostate specific antigen. If it is high, he will need further investigation on an ultrasound to make sure that they measure the size of the prostate, whether the bladder capacity before and after taking fluid. We call it pre and post void urine, whether he's retaining urine, and finally whether he's got obstructive uropathy. So both of them need investigations. You can't only rely on blood tests here.
Jazakallah khair for that, doctor. I'm a 60-year-old female with severe arthritis. For the past 2 years, my doctor has given me different painkillers, Coxflam, Miprodol, Vimovo, Celebrex, etc. After hearing the program, should I be worried about my kidney? Now, I know you mentioned this earlier. It's a similar question.
Thank you once again for the question. Let's rephrase it. Should I be worried, or should I now ask myself, in this interval of 2 years, when I've been taking all these medications, which we previously identified as non-steroidal anti-inflammatory, these are the drugs, when you take one Celebrex or one of any of these, there is a decrease in the circulation in the vessel called the renal artery going into the kidney. That kidney is then compromised of circulation for 8 to 10 hours. The answer to your question is, rather than being worried, firstly, advise your doctor that the program suggests that should we not check the kidney function now, because these drugs can do the following. One, they can irritate the stomach lining, so you get gastritis and peptic ulcer disease. Two, they can damage the kidney over time. We call it interstitial nephritis. And three, they can cause chronic inflammation of the bladder. So my answer is, rather than being worried, be proactive. Go and have yourself checked out.
Salams, doctor, how dangerous is kidney stones?
Well, the danger of kidney stone depends on, firstly, how many you have. Secondly, what is the type of stone that you got, whether it's calcium, uric acid, struvite. Thirdly, whether you got recurrence of stone formation. And fourthly, whether or not you treated the original cause. So the danger depends on identifying the stone, adjusting your lifestyle, treating it appropriately. But the moment you got recurrent stones, think along anatomy. Here you got stones, either in the substance of the kidney called the pelvis or the parenchyma, or you got stones that are in the pelvis coming down. It's going to give you pain, discomfort, infection, and over a period of time, obstruction. So it's not a case of dangerous, it's a case of chronic inflammation and damage to a kidney as a result of stone, infection, obstruction.
Jazakallah khair. Doctor, just remind you that you're listening to Medical Files, and we are discussing the prevention of kidney disease. Our guest is Dr. Ismail Ghulam Hussain Rendry, and if you have any questions, you can forward them to us on 060-904-1056. We'll visit the marketplace and continue on the other side of this, inshallah.
Teaching you something new every day. Radio Al Ansar.
Are you still looking for an Eid gift for your loved one? Well, Hershey's Springfield has you sorted. Catch Radio Al Ansar broadcasting live at Hershey's Springfield this Saturday from 10 a.m. to 12 p.m. as we unlock some amazing Eid specials. Spoil your loved one with one of our amazing deals on Dyson Airwrap, air fryers, food processors, Smeg appliances, and much, much more. Visit us at Hershey's Springfield this Saturday. See you there.
Get ready to celebrate the joy of the season with the Cholino Baby Sale. Shop beautiful baby nursery, furniture, travel systems, car seats, and much, much more. We've got everything you need to make this holiday unforgettable for your little one. Shop the Cholino Baby Sale from the 20th of March to the 20th of April 2024 for a unique and fun shopping experience. Visit us at a Cholino Baby store near you or simply shop online at cholino.co.za. Cholino Baby, your premium baby store.
Set your alarms and get ready to dive into the challenge. Tune into the Breakfast Rush and Simplex Radio for your chance to win a stunning brand new Sinotech 50-inch Android TV. But here's the twist. You've got to listen closely to discover the terms of entry. It's a battle of knowledge and strategy, so choose your team wisely. Are you Team Nishal or Team Nazmira?
Get your hands on this incredible Sinotech 50-inch TV, the perfect addition to your entertainment setup.
Stay tuned, stay sharp, and be ready to tackle general knowledge questions like never before. It's about being part of the showdown and seizing victory.
Ramadan, a month to go beyond our ordinary, praying more, giving more, connecting more. Join Africa Muslims Agency to feed the fasting for 110 Rand per day, provide a grocery hamper for 1,600 per month, and feed a village or camp for 17,000 Rand per day. Every donation goes beyond just food and water. It transforms lives, empowers communities, and brings the spirit of Ramadan to thousands in need. Together, we can bring hope to families in Gaza, South Africa, Mozambique, and 18 other countries. This Ramadan, go beyond with AMA for a better world.
We are unity, and you are listening to Radio Al Ansar.
Yes, you listen to Medical Files brought to you by the Islamic Medical Association of South Africa and hosted by myself, Faizal MJ Suleman. We are discussing prevention of kidney disease, and our guest is Dr. Ismail Ghulam Hussain Rendry, a specialist, a physician, and nephrologist. Now, Dr. Rendry, what are the early or late signs of chronic kidney diseases?
Bismillah ar-Rahman ar-Rahim. So symptoms are what the patient will tell us about. Signs are what we pick up. So in this instance, we got a combination. I've mentioned it before, but I'd like to reiterate it. Firstly, swelling. Swelling can be around the eyeball. We call it periorbital edema. Swelling of any part of the body is edema. Swelling of the feet often is due to kidney disease. But at this point in time, you can get swelling of the feet due to kidney disease, a low albumin due to liver disease, or you've passed too much of protein in the urine, Thyroid disease can give you swelling of the feet. Heart disease can give you swelling of the feet. And of course, varicose veins and therefore retention of fluid and menopause. Secondly, I mentioned earlier on that Allah subhanahu wa ta'ala has given us a kidney wherein we excrete two substances, phosphates and uric acid. So itching becomes a problem. If you have stage 4 and 5 chronic kidney disease, they have a lot of itching. We call it pruritus, and they have muscle cramps. So if a patient's got itching, muscle cramps, swelling of the body, feet and around the eyes, the tiredness is due to the low hemoglobin due to erythropoietin production decrease. Sleep pattern changes. Faizal, it's a big problem. They have insomnia. They are unable to sleep. It's a huge problem. They are not functional the next day. Now, as the urea, the poison goes up and the creatinine goes up, patients tell you, I feel tired, I feel drowsy, my ability to concentrate is poor, my memory is not the same. Then they have a poor appetite, they have taste disturbances. So a whole host of these features start to slip in. Then, as I said earlier, they are unable to concentrate urine. So they wake up 3-4 times at night to pass urine. So those are the features of early going on to late chronic kidney disease.
Jazakallah khair, doctor. And, can one have a kidney transplant without dialysis?
Excellent question. By and large, how are you going to identify an individual? Because by the time you want to consider transplantation, your chronic kidney disease EGFR filtration is under 15, between 10 and 15. Under 10, they are mostly on dialysis. My feeling is often we have patients where the EGFR filtration is between 10 and 15. They look healthy. They don't have many of the problems that I mentioned earlier. The hemoglobin is fine, the calcium is fine, the phosphate is fine, the uric acid is fine. There is still life in that kidney. So if you're going to preemptively transplant this patient, remember, a transplanted kidney has its own lifespan. So my recommendation by and large has been over the years, and by the grace of Almighty, this is now medical practice in nephrology for over 35 years, is that wait until you need the dialysis, wait for at least 6 months, during which time when you are being dialyzed, whatever insult there was that caused the progressive decline in your function can be via dialysis turfed out, and then you consider transplant.
Jazakallah khair for that. And doctor, let's talk about lupus and chronic kidney diseases. How are they caused?
Another excellent question. Bismillah ar-Rahman ar-Rahim. So lupus belongs to a family of what we call autoimmune disease. Now, like how you have rheumatoid arthritis, you have a condition called SLE. That's what we mean by lupus. Autoimmune means that our body is not recognizing these proteins as being belonging to us. And therefore, a reaction is set up, usually an inflammatory reaction. Now, the American Rheumatoid Association classifies lupus or SLE into a whole group of categories. So in other words, a patient with lupus will have one or several or many of the following. One, they will have a blood test called ANF that's positive. They may have hair loss, alopecia. They may have skin reactions around the face, around the nose, and around discoid lupus. They may have bone pain. They have lung involvement, kidney involvement, brain involvement. So lupus can involve many parts. Regarding the kidney, a patient with lupus will have an anti-nuclear factor that is elevated. Normally, it should be 0. Less than 1 in 40 is normal, but sometimes they have 1 in 320 dilution, 1 in 640. That patient with a positive ANF, if he or she got the symptoms I mentioned, if he or she got blood and protein in the urine and an EGFR under 60, that's what we mean by lupus with chronic kidney disease.
And doctor, can you suggest some lifestyle changes that need to happen after being diagnosed with the chronic kidney disease or lupus?
Again, a very good question. The first and most important is diet. So from a dietary perspective, rule number 1, you visit your dietitian. Rule number 2, if that is not cost effective for you, try and steer yourself to a vegetarian diet predominantly. Now, of the animal proteins, red meat seems to be more harmful than chicken. But my recommendation to whoever has got chronic kidney disease, once you do your EGFR, take a 2-week period of a total vegetarian diet. No red meat, no chicken. In my case, I even suggest don't even have fish. In that 2-week period, provided everything else is normal, you recheck your urea creatinine, see if there's an improvement. By then you would have had an ultrasound done, you will have checked your urine for infection, and that is one lifestyle modification. 2, you cannot talk of chronic kidney disease management unless you treat the disease that's causing it. So get your HbA1c under 7, get your blood pressure under 130/85, stop all the non-steroidal anti-inflammatories, be very cautious with what foods that you eat. Again, if weight is an issue, get your weight down. Smoking is a problem. Alcohol is a problem. Get all that corrected. Stress can be a component to it. And finally, exercise. So those are the 3 components of lifestyle change.
Okay, a question that comes from a listener. I'm not sure if it's relevant, but Doc, you can advise. Salam's Doc, I'm taking the yellow capsules for arthritis, but I then heard taking of capsule can cause, she says, ULUS. Please advise. Yeah.
Sorry, ULUS. I'm not sure what that term means, but the yellow capsule, it's difficult for us in the studio to know what a yellow capsule is. The only yellow capsule that I can think of belongs to a non-steroidal anti-inflammatory. Again, it could be Voltaren, it could be Vimovo. I don't know what a yellow capsule is, but my advice to you is ask the pharmacist, what is this yellow capsule? If it is what we call an NSAID, non-steroidal, it's going to damage your kidney, then I will avoid it.
Salam's doctor, very informative show. I have a vitamin D deficiency. I take calcium D, or rather Cal D. Does it affect the kidneys?
Bismillahirrahmanirrahim. Okay, important to know whether you are a female or a male. Important to know whether you're postmenopausal, because if you got vitamin D deficiency and you are postmenopausal, right, then you should do a bone density scan. If you do a bone density scan and you got osteoporosis, then you need the vitamin D and calcium. If you don't have osteoporosis, you got osteopenia, then you can adjust your vitamin D intake accordingly. If you got normal bone density scan, then the vitamin D levels, if you look at the big labs, are between 30 and 50. So do a vitamin D level. It might be a little costly, but at least a baseline vitamin D level will tell you where you are sitting rather than taking medication. Now, there are 2 types of vitamin D. The one that you can take daily, or you get the concentrated one. An example of that is called calciferol. It's a purple tablet. Faizal, I'm now using color schemes on this program. So the purple tablet is a 50,000 international unit of calciferol. We take it once or twice a week. But vitamin D excess is not what we want. And I'm not sure what you mean by deficiency, because the level is important.
I'm now just trying 2 questions before I ask you to summarize and round up. I'd like you to just discuss very quickly diabetes, hypertension, eclampsia, and pregnancy, and how that will affect the kidney in future. And the question that's also come through, which is relevant, is I am 35-year-old with 2 children. In both pregnancies, I was told I have high sugar and protein in my urine. I have not seen any doctors since. Maybe you can just join the queue and then we'll round up, inshallah.
Bismillahirrahmanirrahim. Excellent question again. So here is a patient. She was pregnant for the first baby, pregnant for the second baby. The gynecologist noted sugar in the urine. They did a GTT. She was what we call gestational diabetes. Along the way, in the trimester, 3rd trimester, she now starts to swell up. There's protein in the urine, and eventually the blood pressure goes up, uric acid goes up. She was told she's got preeclampsia, eclampsia. Now, the first pregnancy went through fine. Second pregnancy went through fine. She's now busy with bringing up children and looking after herself. The first mistake, and we can't do anything about it, is she's not following it up. Chronic kidney disease is an accompaniment of diabetes and high blood pressure. And this particular patient must ask, do I have a family history of high blood pressure and diabetes? Do I have high blood pressure? If I haven't checked it, check it with the ECG. Do a GTT now, post, to see whether you're diabetic, pre-diabetic, or what we call insulin resistant, and then work accordingly. So my concern for this patient is, yes, you've been busy, but now take cognizance of the fact that you need to look after yourself in addition to your husband and the 2 children.
Jazakallah khair, Dr. Henry. I want to thank you for joining me in the program on this particular
It was
program.
a pleasure.
But before you leave us, I'd like you to just give us a short summary of our discussion and your take-home message for our listeners.
The summary is simple. All of us during the month of Ramadan required to fast. We had additional prayers for Taraweeh. We needed the Tilawat al-Quran. We had zikr. We had so many other duties to perform. None of these would have been performed if our health was not optimal. Mm-hmm. So this program, like any other program on your medical file, is designed to educate and highlight our listener, be proactive. Once the program is over, my take-home message is, if you're diabetic, high blood pressure, all the conditions we mentioned, please, the lab does not charge a lot. It's called a cash doc form. Get your doctor to check your HbA1c, your urea creatinine, EGFR, your thyroid function, your prostate cancer test, whatever is relevant for you. Do it after Ramadan and be proactive. Don't rely on symptoms, because chronic kidney disease, the symptoms occur very late stage. That's the take-home message. Also, as I've done in the past with you, Faizal, Almighty blessed us with a life. It's an amanat, it's a trust. If we don't look after it, we will be neglectful and will be answerable on the day of Qiyamah.
Jazakallah khair. Doctor, there are more questions coming, but unfortunately, time's against us. I've got like 30 seconds. But I want to thank all our listeners who have forwarded our questions, and those questions that we didn't deal with, we apologize to you because of time constraints. But Dr. Ismail Glums and Randy, they say Jazakallah khair for joining me on the program. May Allah subhanahu wa ta'ala reward you for your sacrifices and for having shared, the knowledge with us. And of course, enjoy the rest of the weekend and have a wonderful Eid as well.
Jazakallah khair.
Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum assalam wa rahmatullahi wa barakatuh.
We spoke to Dr. Ismail Ghulam Hussain Randri, and he spoke to us about prevention of kidney diseases. I want to thank the engineers who have engineered for me, on this particular program. And inshallah ta'ala, from next week, that is, there will be no medical files next week, but inshallah the next medical files will be on the Tuesday after Eid at the normal time. That's at 8 o'clock on the Tuesday evening. That is after Eid. So Jazakallah khair for joining me, and for myself, Faizal MJ Suleman, and the Medical Files team, it's Assalamu alaikum wa rahmatullahi wa barakatuh.
The Al Ansar Foundation, Da'wah, Tarbiyah and Education, establishing the foundation